Good morning. This is Dr. John Ventura, one of the owners of IHCPR, Integrative Healthcare Practice Resources. I'd like to tell you a little bit about myself. I practice full-time with Rochester Chiropractic Group, a 5-doctor, 2-location practice up in Rochester, New York. I teach part-time with the New York Chiropractic College as an assistant clinical professor, and I'm also a clinical instructor in the Department of Family Medicine at the University of Rochester School of Medicine. I volunteer as a clinician with the Mercy Outreach Center, and for the past 3 years have been involved with the National Committee for Quality Assurance Back Pain Recognition Program. My office was privileged enough to be part of the original pilot project on this program, and as of 2008, all the doctors in my group have achieved recognition status with the NCQA program. Tell you a little bit about my practice. Probably our most distinguished feature is that we do have recognition status in the NCQA Back Pain Recognition Program. Another feature is that more than 60% of the new patients that come into my practice are referred by medical physicians. And I'd like to tell you a little bit about how we were able to accomplish and achieve that. The simplest thing that we did is that we communicated what we are doing to the patient's primary care physicians. That process alone over time allowed us to build some measure of trust with the physician community in our area. I know that the term cultural authority is bantered around back and forth in our community, and I'd like to tell you a little bit about what that term actually means. There are two components to cultural authority: legitimacy and competency. For those of you more interested in this topic, I would refer you to a book called Surviving in Healthcare by Dr. Ensman. Dr. Ensman is, I believe, a radiologist who took a sabbatical to study the sociology of medicine. And in doing so, he looked at how medicine was so adept at achieving cultural authority through the 1900s, and then towards the end, by the 1980s, began to lose some of their cultural authority. They had to ask permission to admit a patient to a hospital. And then how could they get that back? This becomes a model for the chiropractic profession to follow in terms of how to achieve cultural authority, something we haven't been able to truly accomplish yet. Well, you have to demonstrate your legitimacy, you have to demonstrate your competency. I firmly believe that working within the NCQA Back Pain Recognition Program is a definitive way to demonstrate your competency. It actually is a way to measure the quality of the care you're delivering based upon a national standard of care. It is the same measure that surgeons have to meet. It's the same measure that medical physicians have to meet to demonstrate the quality of care they give in back pain, in managing back pain. And that's really what makes this program so significant, and why I would so encourage more of our profession to get engaged with the program. The simplest thing to do is to go to www.ncqa.org and look up physician recognition programs, and then specifically the back pain recognition program. If you're a member of the ACA, the American Chiropractic Association, then I would recommend you go to www.acatoday.com and look up back pain recognition program. As I mentioned, the benefit of the program is that you're able to clearly demonstrate to others that the care you're delivering for back pain is quality care. There are specific measures that you have to meet clinically, and more importantly, document that you have done those measures in your patient chart, be it paper or electronic. In addition, there are 3 structural standards, 2 of which non-surgeons have to meet. You have to measure the patient satisfaction and then actually track that data and implement a quality improvement program based on those results. And you also have to provide your patients with an education tool that lays out what their condition is, what their options for treatment are, what are the risks of the care you'll be providing, and what is the evidence base for the care you're providing. Those structural standards don't need to be documented in the patient's chart, but they do need to be a part of the processes within your office. By demonstrating that you do provide quality care, you'll achieve a measure of trust with the public and with physicians in your community. In doing so, they'll be much more likely to want to use you as a referral source. When we've asked physicians what are those qualities that you look for in a chiropractor if you're going to choose to refer to them, they often describe an effective communicator. That is, that you are conveying back to the referring provider what you found, what are the relevant positive and relevant negative findings, and more importantly, what you're going to do with that patient, and that are you measuring the outcome of the care that you're delivering so that you can alter as the need arises. Secondly, they want to know that what you're doing is safe. Again, participation with NCQA shows that you're following a quality-based standard for your care and that what you are doing is safe. In addition, is there an evidence-based for what you're doing? Again, following NCQA's back pain recognition program processes demonstrates that you're following the most patient-centered, evidence-based program for the management of back pain that you possibly can. On November 20th in Waltham, Massachusetts, IHCPR will be putting on a conference which will help address some of these issues. We will be offering a way for you to help build your practice to gain a larger part of the market share in your community in a very patient-centered, evidence-based way. There will be information about how to brand yourself. That is, all the information that you're conveying to the community is consistent and conveys the important message that you are a patient-centered, evidence-based provider. In addition, there'll be information about how to use some of the social networking programs such as LinkedIn and Facebook to promote yourself in your community. We'll have doctors speak who work in multidisciplinary centers. One doctor who works in a hospital-based spine center, another doctor who works in a 20-physician practice of multidisciplinary providers. In addition, we'll talk to you about how to measure the quality of care you're giving and then communicate that to providers in your community who may refer patients to you. I would encourage you to go to www.ihcpr, where you can get more information about this program. You can also go to our Facebook page. Just go to log into Facebook and search IHCPR, and you can get more information about how to sign up for this most important seminar. Thank you for listening, and I look forward to speaking to you again.